It's 1:40 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities, and that should begin any moment now. In the meantime, a few updates. South Korea, ahead of a general election this coming Wednesday, held 2 days of early voting over the weekend on Friday and Saturday, and the total turnout came to 26.69%. That's the highest turnout for a general election on record. Now, we're getting word now that the briefing is starting, so let's cut to that.
So I will now start the regular briefing for COVID-19 cases in Korea. It is April 12th, and for today, the total number of confirmed cases amount to 10,512, and 912 cases are cases coming in from abroad. And of this, around 71.1% have been discharged. Yesterday, we have seen 32 additional cases confirmed, and there were 125 additional people discharged. And as a result, we have seen a decrease in the total number being quarantined. And across Korea, around 81.6% were related to cluster infection, and 9.8% are undergoing analysis and categorization. Let me walk you through how the infection have been transmitted for the past 2 weeks. And we have seen most cases coming in from abroad. And from the nursing homes and the cluster facilities, it was around 21%. And also we have seen other cluster infection, which amounted to around 8.8%. And those who were infected due to contact of the confirmed cases were 3.6%. And we have seen 32 additional cases yesterday, and of these, 24 were people coming in from abroad. And it was Americas and Europe amounting to 18, and the rest were from other areas. And let me walk you through what we have analyzed so far for the cluster facility. Related to the Fatima Hospital in Daegu, one person was additionally confirmed during the self-quarantine stage, and we are actually proceeding with the contact tracing and monitoring. And in Yecheon of the Gyeonggi province, we have seen 3 additional cases, and as of April 9th, we have seen 11 total cases, and we are undergoing the epidemiology research. The Central Disaster and Safety Countermeasures Headquaters since March 18th has seen an increase in the number of confirmed cases from people coming in from U.S. So we will be strengthening the measures for people coming in from U.S. Before, we used to actually have the test when we have seen these symptoms. However, from now on, we are going to change it so that we're going to go with self-quarantine right away. The Central Disaster and Safety Countermeasures HQ in relation to the people coming in from abroad are seeing an increase in the infections and transmissions. So we are asking you to make sure to follow the rules on self-quarantine. And in order to prevent the transmission to the family members, please make sure to use individual items and also make sure to not be in contact with those who are living in the same house and family members. And for people living in the same households as those people under self-quarantine, please make sure to use individual items. And also please make sure to use disinfectants to wipe all the surfaces that could have contact with people. And you have to prevent contact with the people in self-quarantine. So we have seen a decrease in the number of confirmed cases. However, if we were to loosen up on the self-distancing, then there could be a risk of the rapid increase in the number of confirmed cases and massive infections. And if this were to be carried out, then there could be risks such as a damage to the medical system. So we want to ask all of our citizens to make sure to follow the rules on personal hygiene. COVID-19 has seen that it has a transmission power even at the early stage, and there are cases where people are not aware of it because it does not have symptoms at times. Therefore, it is very important for our citizens to follow the rules on prevention. We have to make sure to refrain from contact with others, and we have to wash our hands frequently. And we also have to wear the mask when we are visiting closed spaces and that are crowded. And if there are symptoms, then it is important that people go to the triage centers to be tested. And also, we have to avoid closed spaces such as the cafes and the entertainment facilities and etc. And we have to refrain from having gatherings with a lot of people. This weekend, everyone is still participating in social distancing. And we had the early polling for the election, and many people participated in activities such as making sure to have 1 meter distancing, wearing a mask, and using disinfectants while voting. And also, many of the religious leaders also converted their religious services to the online services and is following the rules on prevention of the infection. And many citizens are also refraining from visiting or operating the facilities that could have a lot of people visiting. So we want to thank you for participating in social distancing. However, this weekend we have seen an increase in contact with people compared to the other weeks. And we do expect that this number could happen the most from the several weeks. So we want to ask you to continue to be on alert. It is important for us to follow the rules on personal hygiene. And we believe that some people could have been exposed. So if you have symptoms such as fever, cough, or others, please make sure to stay home and not go to work. And if you continue to see such symptoms, please make sure to visit the triage facilities and be tested. And as such, we have to make sure that we have to prevent the path that is unknown. So when we miss one person that is infected, then it could lead to a massive and explosive transmission to the society, families, and communities. So we have to prevent this. So next week, we want to go back to the beginning for social distancing. So we want to ask you to follow the rules on personal hygiene and social distancing.
기자님들 질의응답 시간 갖도록 하겠습니다. 사전 질의받은 세 가지 질문을 먼저 드리겠습니다.
And that'll conclude our coverage of this briefing. There's another one scheduled for 5:30 p.m., so do tune in again then. Bye for now.